Welcome to the deep dive. Today, we're tackling a really interesting topic in equine health: gastrointestinal bleeding, GI bleeding in horses. It's, one of those things where a seemingly small detail like the color of the manure can actually tell a critical story, sometimes a very urgent one. So, in this deep dive, we're going to unpack the two main types, melena and hematochezia. We'll look at the causes, how vets figure out what's going on, and importantly, the treatment steps. Think of this as your shortcut to getting really well informed on a pretty vital area of horse health. Okay, let's dive in then, starting with melena. Now, this is when you see black, tarry, sticky feces. It's a very distinct look, right? And usually quite alarming for an owner.
It is. And what's really key about melena is why it looks like that, why it's black and tarry. It's basically because the blood has been digested. It's coming from higher up in the GI tract, the stomach, the small intestine. So the hemoglobin in the red blood cells, it gets broken down by digestive enzymes, by stomach acid. And that transforms it, gives it that characteristic dark, almost tar-like appearance. It also it tells you that a pretty significant amount of blood has usually been lost for it to be that obvious.
Right, a large quantity. So when you see that, what are the usual suspects? What's typically causing that bleeding up high?
By far the most common cause we encounter, gastric ulcers. You'll often hear it called equine gastric ulcer syndrome, or EGUS. These can be the upper part of the stomach, the squamous part, or the lower glandular region. And it's not just obviously sick horses, performance horses, or horses under stress. It's surprisingly common, almost like an occupational hazard for them.
Okay.
Other risk factors are things like, high grain diets, not enough forage, stress, and also using NSAIDs, those non-steroidal anti-inflammatory drugs.
Ah, NSAI is right.
Yeah. Then you have duodenal ulcers. That's in the first bit of the small intestine. Yeah. They can cause melena too, especially in foals, often alongside EGUS. Less common, but still serious, would be things like proximal enteritis inflammation higher up the intestine. Tumors, neoplasia in the stomach or small intestine. Very rarely you might see esophageal ulcers if they're severe. And then there are catastrophic, thankfully rare, things like a ruptured aneurysm of a major artery, the cranial mesenteric artery, sometimes linked to parasite larvae migration, Strongyles vulgaris.
Wow.
And don't forget systemic problems, issues with blood clotting, coagulopathies, maybe from severe liver disease, certain toxins, or a condition called DIC, disseminated intravascular coagulation.
So quite a range. And given how serious this sounds, how do vets actually pinpoint melena and its cause? What's the process?
Well, the first clue is visual, obviously seeing that black tarry manure, though sometimes owners might mistake really dark feet, so you have to be careful.
Sure.
But the real gold standard for diagnosing the most common cause, those gastric and duodenal ulcers, is gastroscopy.
Okay, the scope.
Exactly. We pass a small camera, an endoscope, into the stomach.
Right.
It lets us see the lining, the mucosa, directly. But the horse needs to be fasted for quite a while, maybe 12, even 18 hours, so the stomach is empty, and we get a clear view.
Right.
Blood work helps, too. You can just show signs like anemia, especially if it's chronic bleeding, changes in protein levels, albumin, and in really severe acute bleeds, you might see elevated lactate levels.
What's lactate indicate?
It's a marker of poor oxygen delivery to the tissues, often seen with shock or severe hemorrhage. There's also a fecal test available, the Succeed test, which looks for specific markers of GI damage, albumin, and hemoglobin in the manure. Oh, and one important thing to remember, if a horse is on oral iron supplements, that can also make the feces look very dark. And it might even cause a false positive on some fecal blood tests. So that's something we always ask about.
Good point. Okay, let's shift gears then. Hematochezia. This sounds quite different. We're talking fresh, bright red blood in or on the feces.
Exactly. A completely different picture, and it tells a different story. That bright red color is the key. It means the bleeding is happening much lower down in the GI tract. So the large colon, the small colon, the rectum, or even the anus, the blood hasn't been digested, hasn't been altered by stomach acid. That's why it stays red.
So lower down, what kind of conditions lead to this bright red bleeding? What's going on there?
Well, a lot of the time it's linked to inflammation. Colitis, which is inflammation of the large colon, or enterocolitis, involving both small and large intestines.
Okay.
These can be infectious. Think bacteria like Salmonella, Clostridium difficile, C. perfringens. In foals, Lawsonia intracellularis is a big one. These often come with pretty severe diarrhea, which might be bloody itself.
Right.
Then there are non-infectious causes, right? Dorsal colitis, often linked back to those NSAIDs again.
Ah, there they are again.
Yep. Potomac horse fever is another possibility. And sometimes it's idiopathic colitis, meaning we can't immediately pinpoint the exact cause. Beyond inflammation, trauma is a major factor. Rectal tears. These can happen, unfortunately, sometimes during rectal exams by vets or during difficult foalings. They cause very obvious immediate bleeding.
That sounds serious.
It can be, yes. Other causes down there include anorectal lacerations, tears around the anus or rectum, rectal prolapse, where part of the rectum actually protrudes out, anal fissures, fistulas, little cracks or tunnels, tumors, neoplasia in the rectum or the end of the colon can bleed too, parasites. Heavy burdens can cause damage, though usually not frank, bright red blood unless it's really severe damage. And again, those systemic clotting problems, coagulopathies, can manifest as lower GI bleeding, and something called ischemic colitis, where blood flow to part of the colon is reduced, causing tissue damage and bleeding.
Another wide range of possibilities. So how do you diagnose these lower GI issues, the hematochezia?
Well, again, seeing the bright red blood is the first sign. That triggers the investigation. A digital rectal exam is absolutely crucial here. Feeling inside the rectum and the end of the small colon, we can often feel for masses, inflammation, and critically detect those rectal tears right away. Sometimes you can feel the tear itself.
Okay.
For a closer look inside, we might use proctoscopy or colonoscopy. That's using an endoscope again, but looking at the rectum and large colon lining for lesions or damage.
So it's scoping from the other end, essentially.
Essentially, yes. If we suspect an infection causing colitis, we'll run tests on the feces culture or PCR molecular tests to identify the bacteria. An abdominal ultrasound can be useful too. It helps us look at the thickness of the colon wall, check for signs of peritonitis, which is inflammation in the abdomen, or see if there's free fluid from significant bleeding.
Right.
Blood work here might show anemia, definitely signs of inflammation, things like fibrinogen or SAA levels going up, white blood cell counts changing, and electrolyte imbalances are common, especially if there's bad diarrhea. And if peritonitis is a concern, we might take a sample of the abdominal fluid that's called an abdominocentesis or belly tap to analyze it.
Okay, so we've talked about the two distinct colors, melena and hematochezia. But what does GI bleeding mean for the horse's overall health? How serious can this get beyond just the manure signs?
That's a really important point. It's not just about what you see. GI bleeding can be hidden, what we call occult, or it can be slow and chronic, or it can be rapid, acute, and absolutely life-threatening.
Okay.
Slow, chronic bleeding leads to anemia over time. It can cause hemodynamic instability where the body struggles to keep blood pressure and flow stable and eventually lead to shock. Rapid bleeding is an emergency. It can quickly cause hypovolemic shock just from the sheer volume of blood lost, and that can unfortunately lead to death. And with any ongoing bleeding, there's also the significant issue of iron loss.
Are there any particular horses more prone, or any other signs owners should watch for?
No, there isn't really an age, breed, or sex predisposition. It can affect any horse. Besides the obvious dark or bloody feces, owners might notice more subtle things like the horse just isn't performing well, exercise intolerance, checking the gum's pale mucous membranes. If you press on the gum, the capillary refill time might be slow if there's significant blood loss. And sometimes you might just see low-grade colic signs. A bit uncomfortable, restless.
It definitely sounds like something you shouldn't ignore or wait out. If an owner suspects GI bleeding, sees any of this, what is the absolute first step?
Call your veterinarian immediately. There's really no waiting with suspected GI bleeding. It needs prompt professional evaluation, period.
Okay, absolutely. So the vet gets involved. What are the main goals then when treating GI bleeding?
The approach really has three main pillars. First, you have to identify and treat the underlying cause, whatever started the bleeding. Second, you need to control the bleeding itself, stop the hemorrhage. And third, provide really comprehensive supportive care. Manage the consequences of the blood loss. Many of these horses will need to be hospitalized for intensive care and monitoring. And if the horse is hypovolemic, meaning low blood volume, restoring that volume with fluids is absolutely critical, along with correcting any fluid, electrolyte, or acid-based problems that have developed.
Let's get into the specifics then. How do vets actually treat the different causes we talked about?
Okay, so for gastric ulcers, the cornerstone of treatment is reducing stomach acid. The most effective drug for that is omeprazole, a proton pump inhibitor. There are other acid reducers like ranitidine, H2 blockers, but maybe less potent. Sucralfate is really important too.
What does sucralfate do?
It basically forms a protective coating, like a bandage, over the ulcerated areas. Helps them heal and protects them from further acid damage. Diet management is huge too. More forage, less grain. Alfalfa hay can actually help buffer stomach acid. Feeding smaller, more frequent meals. And managing the environment, reducing stress, allowing turnout, if possible.
Right. The management side is key.
Definitely. Now, for colitis or enterocolitis, especially with diarrhea, 5E fluids are non-negotiable, absolutely critical for hydration and electrolytes. We might use NSAIDs like flunixin, banamine for inflammation and pain, but very cautiously, especially if we think NSAIDs might have caused the colitis in the first place.
Tricky balance there.
It is. If infection is suspected, systemic antibiotics are used. Metronidazole is common for anaerobic bacteria. Sometimes binders like activated charcoal or smectite are given to try and absorb toxins in the gut. Probiotics, prebiotics might help support the gut microbiome. And diet is usually adjusted to be highly digestible, maybe gruels or just hay for a period.
Okay. And what about those rectal tears?
For rectal tears, we might use an epidural anesthetic to stop the horse from straining, which could make the tear worse. We gently clean out any feces from the rectum. Depending on how bad the tear is, its grade, it might need surgical suturing or packing. Stool softeners, like mineral oil, are given to make passing manure easier and less traumatic. And antibiotics and NSAIDs are important to prevent infection and manage pain.
So that's treating the underlying causes. How do you tackle the bleeding itself and manage the blood loss that's already happened?
Well, sometimes treating the cause helps stop the bleeding directly, like sucralfate coating an ulcer, or surgically repairing a tear. But if the blood loss is severe, acute, causing significant anemia or shock, a blood transfusion can literally be life-saving.
When do you decide a transfusion is needed?
We look closely at the PCV, the packed cell volume. If it drops below, say, 12%, or if it's falling really rapidly, we strongly consider transfusion. A typical 1,000-pound horse might need quite a bit of blood, maybe 5 to 8 liters of whole blood, sometimes more. 5B fluids are always crucial alongside this to support blood pressure and volume. In very rare, specific situations, we might consider systemic medications to help promote clotting, but that's not routine.
And what about general supportive care during recovery?
It's vital. Managing pain is key, often with NSAIDs if appropriate, or sometimes stronger drugs like opioids. Nutritional support is critical. If the horse can't or won't eat, we might need to provide nutrition intravenously that's parenteral nutrition, replacing lost electrolytes, continuing things like sucralfate to protect the gut lining, and constant monitoring for potential complications is essential. Things like peritonitis, inflammation spreading in the abdomen, or even laminitis, which can be a devastating secondary problem. And I really need to stress again, NSAIDs have to be used with extreme caution or avoided altogether if there's any suspicion of NSAID toxicity being the cause, or if there are known gut lesions.
Understood. So how do you track progress? How do you know if the horse is turning the corner?
Continuous monitoring is key. We watch that packed cell volume, the PCV, very closely, often checking it twice a day until we see it stabilizing and hopefully starting to rise. We're constantly vigilant for signs of ongoing bleeding, worsening anemia, or the development of shock. It's a dynamic process requiring close observation.
Okay. So wrapping this up, it seems the big takeaway is understanding that difference between melena, the black, tarry stool, indicating an upper GI problem, and hematochezia, the bright red blood from a lower GI issue. That distinction is really useful for owners, but, as you've made clear, figuring out the exact cause and the right treatment absolutely needs veterinary expertise.
Precisely. GI bleeding, however it looks, is always a serious sign in a horse. It demands that immediate call to your vet. A thorough diagnostic workup is just essential to find the source, find the cause, because that's what dictates the treatment plan that will be most effective and give the horse the best chance.
So perhaps a final thought for everyone listening, just how important is vigilant observation of your horse's manure? Even those subtle changes in color or consistency. Realizing that could be one of the earliest, most vital clues you get, prompting that call for help that could potentially head off a really serious, even life-threatening situation.